Please go ahead, madam.
Thank you. My paper is titled Endothelial Cell Loss Following Phacoemulsification in Eyes with Pseudoexfoliation, 10-year comparative study. Pseudoexfoliation eyes, which undergo, the IOLs in the study were donated by Alcon and CTR by Orolab. None of the authors have any financial interest to disclose. Pseudoexfoliation eyes, as we know, when they undergo cataract surgery, they may have some endothelial cell loss. In this study by Hayashi et al., it was about 9%. The purpose of our study was to prospectively compare endothelial cell density and best-corrected visual acuity in eyes with and without pseudoexfoliation undergoing cataract surgery. This was a prospective, multicentric study at the 4 centers of ARAVIND eye care system. The PX group included eyes with pseudoexfoliation and visually significant cataract, and control group had patients with cataract without pseudoexfoliation, and these patients were followed up for 10 years. We included patients who were willing for phacoemulsification and had endothelial cell count of more than 1,500 cells. And in the PX group, we did not include patients who had phacodonosis either pre-op or intraoperative zonular lysis and small pupils of less than 3 millimeters. The follow-up was at post-op day 1 month, 3 months, and annually up to 10 years. The 9th year, we did not follow up the patients due to COVID. In terms of workup, we saw the refraction, applanation tonometry, slit lamp photography, and pachymetry at all visits. Specular microscopy was done pre-op at 1st year, 5th year, and 10th year following surgery. The primary outcome variable was endothelial cell loss, and secondary outcome variable was the visual outcome. So the number of patients who were included were 930 eyes of 930 patients in the pseudoexfoliation groups, and 476 eyes of 476 patients in the control group. The PX group patients were significantly older than the control group, and we also had more number of males and diabetics in the PX group. In our first year postoperative results, we found that the pseudoexfoliation eyes without the intraoperative or pre-op zonulopathy had an equal risk of complications. And in the 5th year, we concluded that the risk of IOL decentration and PCO were low in PX and comparable to the control eyes. At the 10th year follow-up, the 21.6% of the patients had died, and the follow-up rate, excluding death, was about 82% in the PX group and 85.6% in the control group. The endothelial cell density was lesser in the PX group compared to the control group at baseline at the 1st year, 5th year, and the 10th year follow-up. Also at the last follow-up, the endothelial cell count was lower than what it was at baseline in both the pseudoexfoliation and the control groups. A total of 3 patients had corneal decompensation of these patients, and all 3 were in the PX group, 1 in the 5th year and 2 in the 10th year, of which 1 underwent a PKP and 1 underwent DSEK surgery. At the 10th year follow-up, we tried to analyze the risk factors for endothelial cell loss, and age more than 60 years at recruitment was a risk factor, and so was nuclear pallescence of more than 4 on the LOX3 grading, and glaucoma was not a risk factor. While looking at central corneal thickness, at every follow-up, the central corneal thickness was comparable when looking at the PX versus the control group. The visual acuity was compared, and this was comparable in some of the visits. However, in year 2, year 3, year 6, year 8, and year 10, the visual acuity was lower in the pseudoexfoliation group than the control group. While this was statistically significant, this was not significant clinically because this difference was less than half a line difference between the 2 groups. So in conclusion, in this long-term, large prospective study, evaluating cataract surgical outcomes in uncomplicated pseudoexfoliation without small pupils and phacodonosis. The endothelial cell loss was similar in the PEX and the control groups, and the endothelial cell count was lesser in the pseudoexfoliation group compared to the control at all visits. And the visual outcome was marginally better in the control group. However, this may not be clinically significant. Thank you.
The baseline cell count was also lesser in the PX group, right?
Yes.
So the rate of fall was similar, or that was different?
It was similar in the 2 groups. So this is contrary to what we have seen, probably because we did not include the high-risk throat exfoliation. We only included patients who did not have small pupils, who did not have phacodonosis. So this was not very advanced disease. So in that group, when we compared, the rate of cell loss was similar in the throat exfoliation and the control groups.
Even though they started off with
They
lesser
started
cell
off
count.
lesser and they ended up also lesser. They did, but the loss was similar. The percentage of loss was similar.
Yes. Thank you,
Thank you.
Madam.